Hello friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. ULA's mission and vision is to support, educate, and promote union labor in our communities. There are great careers that you can have within the building trades as well as public sector unions. We're here to shed light on those opportunities, what they're doing, what these jobs are all about, and highlight them across the ULA's platform. We're going live now. All right, 5, 4, 3, 2, 1. Hello friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina, where our mission is to support, educate, and promote union labor in our communities. Today, I am extremely proud and privileged to be with a good friend, Jerry Gallo, Sword Health, with us today to learn a little bit more about his background, history, and experience. I've known Jerry for the course of my career in the labor space and been a dear friend. I'm excited to have him on to learn a little bit more about his career or share his career with you. So Jerry, thank you for joining us today.
Thank you for having me, Michael.
You're welcome.
Good to see you.
You too. I know you made a big trip from Connecticut and to get here, and I'm so thankful for making it.
Not that I live there. I live in New York, but yes, had to go to a board of trustee meeting today to do a presentation, and then you offered for me to come visit you today, and I drove from Connecticut for you.
Oh, you're the man. You're the man. Well, thank you for making the time to sit down with us. So for the audience, can you tell us a little bit about your background? Again, you have an extensive labor career. I know this is family to you as well. So for the audience, you can share a little bit about how you actually got yourself your first step into the labor space.
Yeah, it's a good question. I mean, I experienced a little bit of labor with my dad, who was a pressman and in the printing trades for many, many years. And then he transitioned later in life to freight forwarding, and was also in a union at that time as well. And when I was a kid growing up, I guess we all kind of have those dreams sometimes of being a police officer or a fireman, or maybe even a carpenter or a crane operator, right? Because that stuff is cool when you're a young kid. Didn't really pursue it. Ended up going to college, and when I got out of college, I got an insurance job. And my first insurance job was actually with Oxford Health Plans back in the day before they got engulfed by United Healthcare. And I sold a little bit of labor in some public sector, but it was really a commercial job. And then I got an opportunity to work for Group Health Incorporated, affectionately known as GHI, the now EmblemHealth company. And when I got there, I really learned large group underwriting, and my job was to sell to labor as well. And I got my first experience selling to labor in 1998 at Group Health Incorporated. And I got to learn from some good people there.
Well, you're old, I guess, huh? You're pretty old, Jerry.
I'm old, and I got started late. Yes, and I am older than you, wise guy.
So you started with Emblem, and then take us through the course of your, I know you got a long...
Yeah, long history. So that was my first experience with labor, and I got to be in some boardrooms and some negotiations and quite colorful conversation that takes place in labor boardrooms, But it was good. It was good training ground for me, and the thing that I really took to heart and that I really noticed was that everybody in the room was really vested in the members and everything about them, right? What they were actually negotiating was on the members' behalf. And like that brotherhood, right, and a sisterhood, you hope that people that you work for and with have your best interests at heart. And I truly believe that that's what happens in labor, is that they want to give the best to their members and make their lives not only at the fund or their job day to day, but their families' lives as well. We constantly hear it with labor, right? Making good money, making a good living, but making sure that my family's got the right health care and that I can retire with dignity, right? Those are the things that I just keep hearing over and over again about labor. So after my experience there, I worked for a few other insurance companies, predominantly in sales roles, and again, still selling to labor and commercial clients as well at that time. And then later in my career, I became a broker. I was actually a retail insurance broker, and I had labor clients, and I also had a mix of commercial clients. And then I had an opportunity to go back to EmblemHealth many years later after GHI and HIP had merged. and I ran non-municipal labor sales for them there and their commercial sales. And that's when I really got to be at the negotiating table with a different lens as a sales leader at that time, and really making a difference in non-municipal labor. And then when I say that, I worked alongside the city accounts as well that was run by a different team. George Babbage, a good friend of ours in labor, and Gary Scarmato and Christine O'Connor. And I got to meet people that they really grew up in labor. They started their careers in labor, and they were in the labor field for their entire careers, where I kind of was in and out with commercial and other things, as I had mentioned. So getting to learn from them as well, how things really work, even on the municipal side of things, was enlightening for me and enriching in my career. And then after that, I left and I went over to the insurance side of things on the retail and wholesale side, and I ran profit and loss for a very small general agent in the Northeast here. And that was another lens to look at things through, but not a lot of labor business. And things changed with COVID, as we know, right? Things changed in your life personally with COVID, losing your dad. And that really was the seed that was planted for you to create the ULA network. And during that time, I was going through my own personal things at that time as well, and taking a look at my life and where I was going with my career. And I wanted to step away from that side of the business, and I took some time off. And then I had a unique opportunity to come to Sword in the digital health space with a good friend and colleague that you know as well, Sean McLaughlin. And Sean and I have worked together almost 30 years now in three different companies with each other, and we've always stayed close personal friends. And he had an opportunity at Sword, and that's when he pinged me and said, "Hey Jerry, I think if you're considering making a change, this might be pretty refreshing." And I made the leap into the digital health space with Sword.
Yep. And the rest is history thus far. So how many years have been with Sword Health today?
So it's coming on 4 years now.
4 years.
4 years, making a huge impact in labor.
Yeah. And for the audience, maybe you could elaborate a little bit more about what Sword Health is and how you're supporting labor today.
Sure. So we are a virtual physical therapy solution. And what we mean by that is we give the opportunity, and I specifically focus on labor. That's all I present and sell to. We want to give the members, the union members, those people, the opportunity to experience physical therapy virtually in the comfort of their own home. So they're not inconvenienced from taking time off of work. There is no cost to the program because the fund pays for it. And we don't want to replace the embedded benefit that they have with their said insurance carrier, right? They can stay with their insurance carrier, their medical benefit that has some PT for brick and mortar, I should say. But we want to complement it, augment it, give them an alternate path to free themselves from physical pain. And we do that with some very unique technology, leveraging some AI as well, but never removing the personal touch with doctors of physical therapy.
Yeah. Let me talk about service is critical, and just having that, that contact to call upon, which obviously drives a lot of value. That's what you believe as well. I mean, having that one point of contact or a team that's really dedicated to supporting those members.
Absolutely. And one of the things that we take to heart is that there's obviously a dedicated team that sells to labor. I'm on it. And then when a fund decides to become part of the Sword family, we pair them with an implementation and customer success team, or account management team, as we like to call it, customer success. We pair them with those individuals that's all they do is work with labor, right? So they speak the language of labor, they understand what labor's up against, and they want to support it in the best possible way. And to date, we haven't lost a labor client since I've been at Sword.
That's great. And listen, I've been, a customer and as a sponsor, so thank you for the sponsorship and believing in what we do to educate the market on, the core values of what labor is all about, the benefits that are included, have been negotiated for them, and why these particular programs are really driving value for, the building trades, public sector, members to be able to take access and do these from the comfort of their own home, like you mentioned. And we look at, when you're in a trade, these are hourly jobs. It's not easy to get to, a brick and mortar physical therapist location. So to be able to do this at home, and get yourself on a better track as opposed to going through surgeries or, having that ailment and those pains, really is a compounding, issue, right? And maybe you could elaborate a little bit on that. And we look at, again, substance abuse and all these other particular issues that are kind of ingrained in what happens to labor, some of the members.
No question about it.
These are things that help to alleviate or mitigate some of those particular issues as well.
Yeah, no, I mean those are valid points, and it's listen, we've been friends for, as you said, many decades at this point, but also partners now with the ULA and SWORD, right, for 4 years. So you've heard our talk track, and what I'm proud of is the company's evolved tremendously from not just a technology standpoint, but from the impact that we're making for the members that are suffering from physical pain. We've got 1 in 2 adults are suffering from physical pain every single day. No question about it. And when you bring up pain meds, that's a huge issue, right? Because if I'm not doing well physically, I'm certainly not going to be doing well mentally. It's just there's a tremendous correlation, right? The mind and the body. And whether it's the trades or it's a commercial client that we have or it is a public school, doesn't matter.
Right.
Back pain is number one, always number one. And unfortunately, we know that people suffering from back pain are 3 times more likely to suffer from depression and anxiety. So what we see is the positive impact we've made in the members is a 64% decrease in those with depression and over a 52% decrease in those people with anxiety,
Wow.
which are the 2 biggest things, right? And we're trying to keep them from taking pain meds. Unfortunately, we see Advil and ibuprofen being used as a basic food group in the trades, which is really not healthy for them, not healthy for their stomachs, not healthy for their livers. We want to get those people off of that. And then you mentioned surgery avoidance. Surgery avoidance is tremendous because that's where we derive the biggest ROI or return on investment for our program. Because if we can say to a fund, you're paying for these claims, you're paying at an average of $33,000 a surgery in the MSK space or the musculoskeletal pain space. And if we can avoid 10 surgeries, it's over $250,000 for a small fund. There was a fund that I presented to today. They only had 325 members. They're spending over $700,000 on 6 individuals that had surgery related to MSK. So if we can have those people, even half of them, avoid the surgeries, we're saving well over $250,000 for a very small fund. It's impactful.
Yep. And, understanding, the trades, the issues or, that occur from substance abuse, alcoholism, suicide, all these factors that come into place, and how you're able to mitigate some of those particular areas through, these wellness wellness and utilizing these virtual programs.
Yes.
It's making a massive impact. And the members assistance programs, the EAP programs. Do you work collectively with some of those MAP programs today, and showing those particular value cases or those statistical benefits?
Excuse me. Yes, we do. On a couple of fronts, right? We have partnership arrangements with some of those point solutions and also point solution navigators, right? So we do work in conjunction with them. And some of the programs that are out there are, let's say they do case management for people that are going to undergo some sort of musculoskeletal pain surgery. And let's say that surgery is non-negotiable. They have to have it. There's companies that we work with that will say to them, we're going to help you with your case as you go through your surgical procedure for your MSK issue or ailment. But when you're done and you need PT in a virtual setting, SWORD is the program that we partner with and your fund partners with, right? So we get that warm handoff from an outside partnership versus even our own people, which is tremendous. From a mental health standpoint, there are some funds that have their own mental health programs embedded in the facility, and they want us to help direct their members to those types of programs, and vice versa. We will have that mental health provider within the fund also recommend that the member come to us for virtual PT. SWORD has just launched a program called Mind, which is our virtual mental health solution, and we can talk more about that at another date. But it's just showing the evolution of our organization. You know, when I got here 4 years ago, I had mentioned, the technology has grown leaps and bounds. We're on our fourth iteration of our digital physical therapy joint pain program, and in less than 4 years, right? And we've introduced a women's pelvic program specific for women's pelvic pain. And we know a lot of apprenticeship programs are promoting women in the trades. You yourself, you and Stephanie have participated in the national conferences for women in the trades.
Absolutely.
And we've got to do a better job at that, quite frankly, at SWORD, and promote our women's pelvic program. It's called Bloom. And then we've got a movement program as well. So the company has evolved because, again, those people with physical pain will have some other issues and ailments, and we want to be able to help them and triage them to the right program under the direction of a doctor of physical therapy.
Yep. No, it really is incredible to see, one, the evolution, but just you look at the benefit funds today and a lot of the changes that are happening. Mm-hmm. There's no changes maybe in the medicine, but how it's distributed, how the technology is advanced to be able to provide more value or direct access to these particular, to the membership groups.
Absolutely.
And that ROI, like you mentioned before, as well, is there's proof in the numbers. So statistically, you're able to showcase that. And we had somebody on earlier today. The proof's in the data, and all these this information now that we have it is how do we utilize that, refine that to help drive more benefits to the members, try to reduce some operating expense, not through just driving down costs, but also providing more value through the technology that's available to them.
You're absolutely right.
It's really cool to see because that's the health tech space, the financial technology space. It's understanding you, Jerry Gallo, and what your ailments or what you do on a regular basis, and say, I like to do this, I lift these weights, I do this stuff. What's the outcome of what's going to happen to you? And you could statistically see that. You smoke 10 packs a day, you do this,
right.
This happens. The cancer programs that are out there, all the preventative services that are out there today. And, I think some of the values and how a lot of organizations are really communicating are through different social media platforms, the apps and communication tools that are out there, podcasts like this, just educating the member, the consumer on what's available to them, what the unions have negotiated for them, and driving that utilization. Because a labor organization could take your plan, but if the members aren't utilizing that, what good is it?
No good.
No good. I'd like to take a moment to thank SWORD Health for all their support and believing in our mission at the ULA Network and ULA Network's Charitable Foundation to support, educate, and promote union labor in our communities. Thank you.
And it's funny you mentioned that because the fund that I happen to present to today, I presented to a year and a half-ish ago, and they chose my competitor. And I was a little shocked, actually, by the selection, but nevertheless, they did. So I typically say to the fund, especially when I believe that maybe the decision wasn't in the best interest of their members, okay, that it's okay. I can appreciate the decision you made. I may not agree with it, but I'll be here when you want to come back. And that's exactly what happened. The engagement wasn't there, to your point, right? So what good is it that they bought my competitor and they had 3 people enroll in the program? That's not helping your members. It's not driving costs down for the fund. It's not a good experience for them. So they came to us and they wanted to know specifically what would our solutions be. And I had a couple of experts join the presentation today that talked just about those things. And I think we've nailed it, in terms of getting the engagement we need. And we're not going to profess to know how to promote our program to every single fund without the fund's input.
Absolutely.
Right?
Yep.
they're going to know how best to speak to their members, and we're committed to help them do that in a partnership, right? Being part of each other's family versus us just driving something down their throat. This is the way we do it for everybody. It's not cookie cutter. It's not cookie cutter, right? Yeah. It's one of those things that we pride ourselves on, the fact that we want to listen and see what went wrong with maybe a previous provider, like this situation, and then we're going to do things quite differently.
Yep. No, today's world is about communication. And again, when we deal with typically labor, these are large membership group organizations. So there's a lot of people that need to be reached to be able to implement or make sure that everybody utilizes or knows that the access is available to them.
That's right.
And, I think the areas for refinement through communication can drive those efficiencies. And working in collaboration or having the access and working through the fund office or union leadership to make sure that their members are aware of the negotiated benefits that they put together is critical, because they work tooth and nail to make sure that they can get these rich benefits and implemented and negotiated and go through their actuaries, the consultants. It's a lot of time, a lot of effort to move certain programs and plans, but it's all for the end game and goal is to provide that to the member. And ways that we can do that as providers, as media platforms, is to really just drive down that educational piece and educate people, not only just what the benefits that they have, but like in this particular space too, is what these career opportunities look like in both the municipality, the public sector careers, the vocational careers, and train that or educate that next generation of what these opportunities really do look like. And then how do the service providers that play a major role in the overall ecosystem and benefits of union labor get connected. And I'm so fortunate, over the course of my 20 plus career in labor as a banker, and moving money, that dollar touched every provider that was either under those particular benefit plans, or if it went through the apprenticeship facilities or front office through the locals. Who's paid, who's connected, how do they play a role? And I feel like a sponge in, just learning from each and every individual provider, because everybody plays a role. You talked about, other service providers, maybe they didn't have that, the benefit that they saw. Some groups may love what other vendors are doing. They may have those particular relationships, but it's, it comes down to the relationship, the benefit, the services, how you work to communicate with the union groups as a whole. And again, I'm just so fortunate to work really both sides, working directly for labor and then having the benefit of understanding some of these particular values from the service side. Right. And to make sure that we're really educating them on what these particular values are as well. Because it does, in your case, the MSK, it's, what is it, top 5, spend?
Top three spend.
Top three
spend. And most times it's one or two. Obviously, unfortunately, we see cancer and diabetes highly ranked as far as high claim costs go, but MSK it's climbing. You see statistics anywhere from $500 billion to $600 billion spent on musculoskeletal pain annually, just that, and you're seeing between 6 and 7% trend on that every year. And we know, not soared, the world knows that 50% or so of that spend is wasteful, which means, you might be experiencing some sort of physical discomfort. You go to your primary care physician. Your primary care physician says, you know what, Mike, take some Advil, you'll be all right, don't worry about it. You go back to the gym, you go walk in with Steph, you do some other exercises, and another month goes by, and the pain's still nagging you. You go back to the primary care, what's he going to say or she going to say? Well, let's go to an orthopedic surgeon. You go there, what are they going to do? Well, Mike, you've been dealing with this for what now, 6 months, and you only addressed it the last 60 days? Okay, we're going to send you for an MRI. We're going to send you for a scan. By the time you take that journey, and then they say, you know what, Mike, you got a little bit of a meniscus tear in there. We're going to go in, we're going to scope it. Now you go in for a surgical procedure, and that could be 20, 30 grand. And your employer or your fund, in this case, when we're talking about labor, is paying for that. And it may have been completely unnecessary and absolutely taken care of by an intensive physical therapy program over an 8 to 12 week period for you to just get better. And when you can do that without taking time off the job, right? Work an 8 or 9 hour day off the trucks, right? One of my Teamster clients said, Jerry, I got guys working 8 or 9 hours, and then they're going to get off the truck, and then they've got to go to PT at brick and mortar. They're not going.
Not going to happen. Yep.
They're abusing Advil, right? So you have given them the opportunity to now do this at home on their time, 24/7. It's what we call asynchronous. You do it by yourself under the direction of the model that's on this Thrive pad for you. And we're actually going to be allowing people to use their mobile devices now as well. And you do that exercise regime, it corrects you in real time, and your doctor of physical therapy sees every single range of motion down to each individual rep, down to the individual degree range of motion, and then customize and curate that program. Doesn't matter when you do it. That doctor's going to have access to your data. I mean, it's tremendous.
Yep.
There are a lot of meetings and presentations I open with a dirty word, and I say to them AI, right? Because, look, I'm an older guy too. You're younger than me, but we're of the age that sometimes technology scares people. And what places is going to scare people more than anywhere but in labor, right? Where it is an older school mentality, fantastic negotiators, very smart people, very astute people. They can negotiate their tails off, but sometimes the AI word scares them. And I assure them, we leverage the AI technology to make sure we're delivering a safe and effective product for their members, but never removing that human element.
Right.
Right? And that's comforting because we don't want them to think that they're just calling into a bot and that's it. No. It's not how it works for us. Right? We want that technology to make sure that they're doing their reps correctly. And I'll give you one example. In the board meeting today, one of the board members said, I was using this other program and it wasn't really correcting me. And for over a week, I wasn't sure if I was doing my exercises correctly or not. By the time he got to the healthcare professional to have the discussion, he was doing them wrong.
Right.
With our technology, that would never happen.
Yeah. Well, that holds true too. Is if you're going to a brick and mortar, they put you in the corner, they give you 3 things to do and say, go like this a couple times, and I'll be back in 15 minutes.
That's right.
Who knows whether or not you've been doing it right?
You don't.
In this case, and again, Steph had the opportunity to use your service, your product.
2 times, right?
Twice.
2 different body parts, yeah.
And again, it corrects you if your positioning or your range of motion is not right.
That's correct.
Which is really cool. I mean, again, so you can't do it wrong. It's it's going to put you right on the right path.
And you can't hide from the DPT, the doctor of physical therapy, because they have access to your data.
Yeah. Yeah, it's incredible. And these are the things that labor is evolving to utilize right now, and with technology driving down those particular costs and efficiencies.
Right.
Knowing that your particular plan can drive down overall pharma costs as well because of the
100%.
expenses that are there, it just compounds in from a savings standpoint. So
it absolutely does. And we like to say, so we'll do an analysis for every one of our funds, right? Because the vast majority is self-funded, meaning they're paying their own claims. And if you are doing that, you see the musculoskeletal spend. So we can look at that. We can run the ROI and tell you in a more targeted fashion, this is the savings that we can guarantee.
Yep.
We put it in our contract.
Yep.
If we don't save the fund money, it's free. The program's absolutely free.
yeah, so there's
And
really
that's
no
the
risk
direct
in regards to facilitating.
Thank you. There is no risk for them.
Zero risk.
And that's the direct savings. Now there's indirect savings, as you just mentioned, in RX spend. We don't know exactly who's taking the pain meds or not. We could, if we got that data, then obviously we could do something about it. But most times we don't get the pharmacy spend, but we know we can make an indirect impact with those folks. We absolutely can.
That's awesome, John.
And those are really, really important things. So, if I may, I want to just talk a little bit about kind of the importance of our partnership with the ULA and why I think this is really important. So, I mentioned I started at GHI in 1998, but I was in insurance 3 years prior. I really started my insurance career in 95. So, wow, it's 31 years now. I'm embarking on my 31st year in insurance. So I've seen a lot, right? And when we first started, we call it the digital health space, right? Which encompasses mental health providers, weight management, MSK providers like Sword, and others. In the past, wellness programs were smoking cessation and Weight Watchers. And nobody was really measuring it properly. There wasn't really great engagement. Nobody could really access it well. It was hard to communicate it. Everything was snail mail, but I will tell you, for labor, snail mail still works very well for us as Swords, right? Because we're a little bit more targeted. But what I will say is it's not easy to get the message out. And many times, relationships with labor is everything.
Absolutely.
Once you have that solid relationship like you do, you've grown up in labor, like I've benefited from as well, labor gives you an opportunity. But you can't always get that audience. It's very difficult sometimes to be able to explain to labor that there are other things that will benefit their members. And because sometimes they're a little guarded in that way, what you've created with the ULA network gives them the ability to be in a safe environment like we are with PT, at home, in your PJs, right? We like to say PT in your PJs. You give them the ability to take a look behind the curtain of digital MSK providers and other point solutions out there without having to maybe have a meeting in front of their board of trustees. They can take a look and even talk to you and find out what they really are about. And by doing that, they're a little bit more disarmed. They're a little bit more open to hear about what point solutions are out there and how it could save their members money, right? And I just want to underscore the importance of what you're doing and the impact that it's making in labor's lives. And it's just really awesome to be part of that.
No, I appreciate it. And again,
yeah.
labor's
It's amazing.
taken care of me through the course of my career.
That's
And
right.
because this is family, COVID changed a lot of lives.
Yes, it did.
Continuously talk about, losing a loved one, father, and then what labor's
right.
done in the worst of times to help support me. And, for me as a banker, giving back to labor, if I can inspire, educate, and promote what the career is about and drive more members to these membership group organizations, which is the strength of any organization, then I know I could do and have a life, fulfilled life in giving back to organizations that took care of me. And, the education and the network that we have collectively to be able to talk about these particular services behind the scenes a little bit more, make it a little bit more open and have access, learn who Jerry Gallo is all about, so that when we go to these major events, it's a little bit more easy to communicate or just people know what you're doing.
Right. Right.
And I'm just so proud to be, working directly for labor, work for some union organizations to help share their communication, drive opportunities, engagement to, and highlight their signatories, highlight their members, and then really, validate and promote the benefits, the rich benefits that they have.
Mm-hmm.
It really, again, it's just all encompassing. So to have people like yourself that I've known for the course of my career, you got your network. It's not easy to start a business.
No.
But to have the support of so many friends, my family and labor to help move me along, is the proudest thing for me. And I know I work hard. I'm not going to give up, and I'm just going to keep fighting for these careers, educating these organizations about what they do. And like we talked about, going through the Department of Education, Department of Veteran Services, these opportunities, these drivers, all are really connected. And I'm just so proud to see the evolution of what we've been able to build
Mm-hmm.
and continuously build, going into 2026 and the years beyond. So
Yeah.
I just want to thank you, one, for your friendship, your family to me, and
Same
just
here.
looking forward to this year and the years to come, and supporting labor and, your career with Sword and all the different really incredible programs that you guys are offering to support your membership. So I just want to thank you again for everything.
Thank you, Michael. I appreciate it.
You got it. We'll round it up. So again, I just want to thank Jerry Gallo for all his support. I want to thank you for joining us today. Again, the Union Labor Advisory Network is here to support, educate, and promote union labor in our communities. Please follow, like, and subscribe to what we're doing. If you have an interesting story, have some information you'd like to get out, please reach out, DM us on all our socials. And again, I want to thank you for your time and all your support. Thank you. I'd like to thank all our sponsors for helping to build and promote the ULA network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.